Hi all, my name's Mahin and welcome to my YouTube channel, The Wellness Puzzle. I wanted to use this first video on my channel today to explain a little bit about myself and also the aims of the channel and what I hope it to become. So firstly, my background is as a physiotherapist. I work as an advanced practice physiotherapist specialising in pain management. I work with people who suffer from long-term pain conditions such as fibromyalgia, chronic lower back pain, chronic widespread pain. Working in pain management has taught me how complex pain is, but also how many different strategies there are to manage pain. And this goes way beyond things like medications, injections, and surgery. Now, on this channel, what I aim to do is to talk about these self-management strategies to manage your pain, so that we can reduce the reliance on things like medications in the future. I also work as an independent prescriber, which means as a physiotherapist, I can still prescribe medication within my field, which is pain management. So I can talk a little bit more freely about medications as well, and also the current evidence around medications and what's suggested to be more effective and what's suggested to be less effective as well. So even though pain management is seen as a specialist area to work in, since I've been working in this area, I feel like the strategies I talk to patients about have actually become less specialised in a way because they've become a lot broader. So I discuss lots of different lifestyle interventions to help manage pain, such as sleep, diet, social connection, and physical activity. And that's reflected in my 5 pillars of health and wellness, which are diet, exercise, sleep, mental well-being, and social connection. So it's really my experience in pain management that's brought me to setting up the Wellness Puzzle, because I'm talking about these things on a daily basis, and lifestyle interventions go a long way, not only to managing health, but also helping people participate in activities when living with a condition such as persistent pain. So although the focus of these YouTube videos are going to be for those suffering from pain itself, it will also be useful for those just looking to improve their health. I've actually taken on a lot from working in pain management for my own health, and I've learned a lot along the journey. And although I don't suffer from pain myself, I've been able to make some really good changes to my lifestyle, which has improved my wellness in general since I've been working in pain management. So I'm really looking forward to sharing those things with you, and whether you struggle with pain or not, I think you're going to find the content in this video really, really helpful. So if you're watching this and you suffer from chronic pain yourself, then please keep tuned to the future videos that are going to be coming up. We're going to be going through lots of things that hopefully you'll find helpful. And if you do have any suggestions or anything you would like me to cover in these videos, then just pop a comment in the box, or you can email me at mahin@thewellnesspuzzle.com. Alternatively, if you know someone who is struggling with chronic or persistent pain, then please signpost them to this video, make them aware of it, and hopefully they can find the content on here helpful as well. There have also been recent clinical guidelines for chronic pain by NICE. NICE are the National Institute of Health and Care Excellence, and they provide evidence-based guidelines for us as clinicians to make sure that we're providing the best evidence-based care for patients. The recent guidelines have caused quite a stir, to say the least, and especially on social media and some newspapers as well, writing articles about patients' experiences and also clinician experiences and their views on the recent NICE guidelines. So I do aim to give you my own stance on those guidelines at some point in the near future on one of these videos, but also hopefully provide a bit of an explanation of how NICE came to those guidelines, the evidence around certain suggestions, in particular medications, because I know that's been a bit of a hot topic recently. So we'll get into that, and hopefully I can provide a little bit more of an explanation and help people maybe understand why NICE came to that decision. I'm also really hoping that this pain management series can be an ongoing series. Because I work in this area, I feel I have got a lot to share around strategies to manage pain. So I feel like it's only right that I come onto this YouTube channel and share my experiences and also share patients' experiences of what's worked for them. There aren't always pain management services everywhere in the country, and we know that chronic pain affects over 1/3 of the population. So in the UK, that's roughly around kind of 45% of people suffer from long-term chronic or persistent pain, which basically means pain that's been there for longer than a 3-month period. Because the prevalence of chronic pain is so high, it's been one of the reasons why I wanted to start this YouTube channel and help people discover ways to manage their pain. So I just want to be absolutely clear about what type of pain I'm going to be referring to on these videos. So I'll be referring to chronic, persistent, or long-term pain, and you'll see those terms used interchangeably, so chronic, persistent, long-term. And that basically talks about pain that's been present for longer than a 3-month period. Often with chronic pain, there isn't an identifiable underlying cause that's seen on tests or investigations. So if you are struggling with this type of pain yourself, you may have had MRI scans, blood tests, and so on, which haven't always shown an explanation for your pain. Now, that's not to say the pain's not there, it's just that the pain can't be explained by tests and investigations, and this is very, very normal. 90% of the pain that I see can't be explained by tests or investigations, so I just want to kind of reassure you around that. If you have had tests that have come back normal, and I'll put that in inverted commas as normal, that your pain is still very real, it's just it can't be explained by a test. Tests, they measure very specific things, and they will measure if anything is particularly worrying or serious that we need to act on. But past that, it doesn't tell us why someone has pain or how much pain somebody's in. So the pain I won't be talking about is pain that is associated with another condition such as cancer or vascular pain. The content on this channel won't be appropriate for those types of pain, but it is more appropriate for things like fibromyalgia, chronic widespread pain, chronic lower back pain, and especially if you've had tests and investigations that have come back normal and haven't provided an explanation, then this channel is going to hopefully be helpful for you. So this video has just been a brief one. It's been more of an introductory video, and I hope you've enjoyed it. I hope you'll tune in again to this channel so that we can continue this journey together. And I'm looking forward to helping you lead a life full of health, freedom and joy, knowing that pain will not be a barrier. As I mentioned earlier, any questions, any suggestions, anything you'd like me to go through during these videos, pop a comment in the box below or send me an email at mahin@thewellnesspuzzle.com. Look forward to speaking to you soon again. In the meantime, take care.